again, thank you for joining us today. Today, the objective is to introduce you to the different types of patient assistance resources available on the Needymeds website, and our website is needymeds.org. Here is our homepage. Needymeds is a national nonprofit organization. We were founded in 1996 by a retired family physician, Dr. Richard Sagel, who remains our president to today, and a medical social worker. They discovered patient assistance programs, and they thought every patient and every prescriber should know about them to increase patients' access to medications. And because this was the mid-90s and the internet was becoming a major source of information for people, they decided to create a website. And so that's exactly what they did. And since then, we've grown to become the yellow pages of patient assistance programs. We are an informational resource. And through our website and toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including medication. We do not offer financial assistance directly to patients, but we do refer them to programs that will. And every year, about 1.3 million people across the country use the Needymeds website. And this includes patients and their family members, healthcare professionals, social workers, and patient advocates. There are a few different types of patient assistance resources that I'd like to demonstrate for you today. Our website, as I mentioned, began with just a handful of patient assistance programs. But since its inception in the mid-90s, our website has grown to include over 7,000 programs, ranging from programs that will provide free or discounted medicines, to coupons and rebates, and to discounted imaging services across the country. All the information on our website is available online at no cost, and without registration, so you can protect your identity. And you'll find all of the financial assistance programs in one place on the Needymeds website, and that is the Patient Savings tab. As I mentioned, there are a few types of patient assistance programs on our website, and we've divided them into 4 or 5 main categories. The first are prescription assistance programs, which we'll talk about in just a moment. We also have a section for diagnosis-based assistance, which will help with costs other than medications. We have a section of coupons and rebates. We have a drug discount card, and we have a few other smaller resources on our website as well. You always want to start by looking for prescription assistance programs, because those will provide the greatest amount of assistance. Prescription assistance programs will provide free or deeply discounted medication to people that qualify. These are programs that are offered through pharmaceutical companies. There's no law requiring a pharmaceutical company to have such a program, and that means that each company can do its own thing. So not every drug will have a patient assistance program for it, and eligibility requirements and the application processes will vary from program to program. Some will help uninsured people, some will help underinsured people. It varies. One common requirement, however, is that no matter which program we're talking about, the patient's prescriber needs to be involved in the application process. And that means providing a valid prescription for the medication and also signing off on the application. So where do you find more information about patient assistance programs? Well, that's where Needymeds comes in. And with that, let's begin the tour of the website. So here is the Needymeds homepage. And to continue our discussion of prescription assistance programs, you can search for the medication in 2 ways. The first is to simply type the name of the drug into the drug search box, like this, and it will pull up the prescription assistance program. The second way to find a medication is to click on the Patient Savings tab, where you'll find all of the patient assistance programs. And then in the left corner, you'll see prescription assistance. And you can search by a brand name drug, a generic name drug, the name of the program, the name of the pharmaceutical company that makes the drug, or the name of the particular application if you know it. Let's say I want to search for Abilify, which is a brand name drug. There's an alphabet bar. Takes me right to Abilify. You can see here there's a little scissors icon under Abilify. That lets you know that there's also a coupon available, which may come in handy if you or your patient need immediate assistance with trying to access Abilify. You'll also notice that it says View CR Article. CR stands for Consumer Reports. Needymeds is very proud to have a partnership with Consumer Reports, and we're grateful that they allow us to put their information on our website. And you'll see here, if you click on this link, it's an article discussing antipsychotic drugs, and it mentions Abilify, and you may be interested in reading it. But if we click on Abilify, it'll take us to a prescription assistance program. This one is run by Bristol Myers Squibb Patient Assistance Foundation. Should you have any questions about this PAP or this application process, please direct your questions to Bristol Myers Squibb Patient Assistance Foundation using either their toll-free helpline or the link to their website. Needymeds is the informational resource that can connect you to these programs, but we cannot speak to these programs and their requirements with any in any specific way. You'll see if you scroll down, there's an active PDF link to the application. You can click on it, you can fill it out online, and then you can print it out and get it ready for your prescriber's signature. The section where it says medications will tell you which Abilify this covers. In this situation, it covers an oral solution as well as a tablet. The eligibility requirements is where you'll learn who may apply to this program. In this case, the individuals who are applying must not have any prescription coverage, which means they can have health insurance, but just not coverage for prescription medications. And the income level is also something you want to pay attention to. In this particular case, they're looking to help people at or below 250% of the federal poverty level. What does that mean in practical terms? Well, if you click on the FPL income calculator right here, we can see exactly what that means. So let's say we have a family of, let's say, 3 people, and they earn $51,000 per year, and they don't live in Alaska or Hawaii. We could calculate and we can see that their yearly income is 253% of the federal poverty level, 253. Going back to the eligibility requirements, you'll see that Bristol Myers Squibb wants to help people who are at or below 250%. But don't give up hope, because what we would recommend is to call Bristol Myers Squibb Patient Assistance Foundation and ask for an economic hardship exception. The representatives who take the calls at these programs have the authority to make economic hardship exceptions for people, and they do this all the time. If you don't get the answer you want the first time you call, perhaps call back a little while later or on a different day and speak with a different person who might give you a different answer, because there is some subjectivity involved in this application process. In the application section, it will tell you how to submit your application. In the medication section at the bottom, you want to pay attention to where the medication will be sent to. In this case, it will be sent to a doctor's office. Sometimes it could also be sent to the patient's office, or if you're going through a health clinic, it might be sent to the clinic as well. And you also want to look at the reapplication timeline. In this case, they want you to reapply for this program every year. So that's something you'd want to mark on your calendar. So that's a prescription assistance application. And I found that, again, under the Patient Savings tab in the Prescription Assistance section. This section will also include copay cards. Copay cards help people who have health insurance but have very high copayments and therefore cannot access the medications they need. But you'll find copay cards in the prescription assistance section as well as the diagnosis-based assistance section, which we'll discuss in just a moment. You can also search for generic name drugs, and I want to point out to you that Needymeds has partnered with RX Outreach to fund a program to help people get free generic medications. You can just search, if your medication is one of these included in the program, it will come up when you search for it by name. Or if you want to see the complete listing of drugs we are currently covering, click on program name, then click on G for generic assistance program. And here it is. And there's an application process, and right now we currently have, I think, about 20 drugs that we're covering. And again, this is something that Needymeds is funding in partnership with RX Outreach. And we are currently collecting donations. If you'd like to contribute to this worthy cause, we'd be happy to and very grateful for any contributions you might want to make to this program. It's a myth that all generic medications are inexpensive. Some of them are actually quite expensive and not within reach of a lot of people's income. So that's something new at Needymeds. You can probably guess that some of these applications for medications are complicated, and they might be doubly so for someone who doesn't have internet access in their home. And if you are a patient advocate or a healthcare worker, or if you are a patient and you need some help filling out these applications, there's a section here called Help with Prescription Assistance Applications. If you click on it, it will pull up a directory of nonprofit organizations across the country that will provide help to people in person filling out these applications. You can search by a zip code or you can search by state. So for example, in Arkansas, we currently have 24 nonprofits willing to help people either for free or a small fee fill out these applications and guide you through the process of applying. And again, that's under the right here, Help with Prescription Assistance Applications under the Prescription Assistance section. Below that, you'll see we have a directory of free, low-cost, and sliding scale clinics. Currently, we have about 13,000 of them listed across the country, divided between medical clinics and dental clinics. And if, for example, you or your patient or client live in Florida and you'd like to see all of the low-cost clinics, you can search either by zip code or by state. In Florida, you currently have 534 free clinics. You can see here that we provide the contact information, a link to the website, the eligibility requirements for who may be seen at the clinics, and also the details in terms of services provided. So this is where you'll find clinics that will do STD testing and also women's health services as well. And that's again where I found that. Underneath the free clinics, we have a section for coupons, rebates, and more. You can search by a particular product's name, or you can search by a category. So if I click on category, for example, and then I click on diabetes, I'll pull up a listing of coupons related to diabetic supplies. So you'll see here we have a listing of testing strips and monitors and pens and meters and so on. And we try to keep this as up-to-date and comprehensive as possible. Under the Patient Savings tab again, in the center you'll see we have disease-specific types of programs. Disease information pages will give you an overview of a particular condition or disease. For example, if you click on lung cancer, we've partnered with the Longevity Foundation to maintain this page. Here, all the links on the right will take you to the Longevity Foundation's website where you'll get medically accurate information about lung cancer and resources for support and so on. And at the bottom, we've included a list of commonly used medications in the treatment of lung cancer. And you can see here, if it's a blue active link, that means there's an active PDF, PAP for it, I'm sorry. And if it's a black text, that means that there was a PAP program, but it is closed. And when it reopens, we'll reactivate the link. And then it also suggests other places you might look on the website for financial assistance for lung cancer. Going back to the Patient Savings tab, you'll see we have a diagnosis-based assistance section. You can search by a condition or a diagnosis, or you can search by location, or you can search by the program name if you already know it. For example, if I wanted to search for cancer, I'd click on diagnosis, I'd click C for cancer, and I can click on cancers in general. And it will pull up a directory of programs. They're listed first with national programs, and then under national programs, we've got them alphabetized by state. And generally speaking, this is where you'll look for assistance for help with expenses other than medication. For example, you might find reimbursement for travel expenses or house cleaning services, supplies, equipment, testing, wigs for chemotherapy patients, and so on. So as I mentioned, you can search for cancer in general, but you might also want to check out particular types of cancer. So again, going to diagnosis, I can search for breast cancer. And here's a directory of programs that help with breast cancer. I could also search by, for example, pancreatic cancer, and so on. So you can search for cancer in general or a specific type of cancer. And again, this section includes Copay Cards, which are also cross-posted in the prescription assistance section. Underneath the diagnosis-based assistance section, you'll see we have a directory of camps and retreats. You can search by diagnosis, or the camp name, or the camp location, or the sponsor of the camp. So for example, if I wanted to see camps for children with ADHD, again, it would pull up a directory starting with national programs, and then under national programs, it will be alphabetized by state. Back to the Patient Savings tab. Underneath camps and retreats, we also have a section for scholarships. So you can search by diagnosis, or the residency of the applicant, or the scholarship name if you already know it. On the right side of the Patient Savings tab, you'll see we have a section for government programs. This is where we have programs that are funded either federally or by the states or county levels. We've also included in this section SHIP sites. SHIP sites are federally funded health advisory programs that will provide health insurance counseling to Medicare recipients. And we've recently added assistive technology programs all over the country here. And this is also where one might find the PACE sites. PACE is the acronym for Program of All-Inclusive Care for the Elderly. And it's a Medicare and Medicaid program that helps people meet their health care needs and tries to keep them in their homes as opposed to living in a nursing home. We've also, for your convenience, included the federal poverty guidelines and also tax return request forms. I mentioned we have a few additional resources as well on the website. Here's where you'll find that. We've got Healfundr, which is something Needymeds created. This is a crowdfunding platform specifically for medical expenses. It's like Kickstarter or Indiegogo or FundMe. The difference is that we verify the medical condition, and we also make sure that the money or the funds raised are going toward the medical bills. And this is so that we can try to reduce or eliminate the chances of fraud. Patients can start a fundraising campaign to help pay for any type of a medical expense, either one that's already incurred or one that you're saving up for. That includes cosmetic procedures, perhaps orthodontia for your children, sex reassignment surgery, and so on. Organizations can also use Healfundr for their fundraisers as well. And we'll help you maximize your impact by helping you spread the word on our social media pages as well. Again, going back to the Patient Savings tab, we have partnered with a company that will provide a discount on MRI and CAT scans. Currently, this includes 2,500 imaging providers across the country. The savings range between 50 to 75% off of imaging services. If you'd like more information, you can call this 888 number here or click here for an online application. Going back to the Patient Savings tab, we've also partnered with a company that will mediate medical expenses. So if you or your client or your patient has $1,000 or more in unpaid medical bills, this may be of interest to you. For a fee of $200, this company will negotiate on your behalf to bring down the cost of your bills. And they say that the average savings is between 30 and 50% off of your total bill. $200 is a lot of money, but if, for example, you had an emergency room visit when you did not have health insurance, and you have a huge bill, maybe thousands of dollars, this may be something you'd want to look into. You can call Needymeds and we'll give you more information about this. And the last way that people save money is with our drug discount card, which I'll show you in just a moment, but I just want to go back to the PowerPoint. So here's a picture of the Needymeds drug discount card. It's another way patients can save money. Users can save between 0 and 80% off the cash price of prescription medications, over-the-counter medicines and supplies written as a prescription, and also pet prescriptions if you're filling them at the pharmacy. How does the card work? Well, our drug discount card works the way all drug discount card works. Basically, pharmaceutical manufacturers negotiate a discounted price with pharmacies through the aid of an arbiter. The discounts are frequently renegotiated and they change frequently. They vary month to month and from pharmacy to pharmacy. So we always recommend trying to use the card each time you make a purchase at the pharmacy. There are no eligibility requirements for this card. There's no registration, there's no activation. The card is ready to go as soon as you get it, and there's no application. There are a lot of drug discount cards out there, but what's different about the Needymeds card? First of all, it's always free to obtain and use. We never charge the consumer to use our card. Second, we do not collect any identifiable information about the users, and it's totally anonymous. So we're not selling your information to third-party marketers. We only track savings. We don't track who's using the card and what they're buying. And third, because we are a nonprofit, we don't try to maximize our own profits with this card, which allows us to pass on the greatest savings to the consumer. We collect a small transaction fee each time the card is used, but that helps us with the administration of the card and the website. But as I said, the card is always free to users, and the card never expires. One card can be shared among a whole family. Just bring your card and a valid prescription to the pharmacy. It's currently accepted at over 63,000 pharmacies across the country, and that includes all the major chains like CVS, Rite Aid, Walgreens, and also a lot of the smaller local chains as well. And if you ever have trouble using the card, there's a number on the back of the card that you can call, and they'll help you. So who can use the card? Anyone, literally anyone. We look at this card as a way to fill a gap. So where someone might not be eligible for a prescription assistance program, perhaps due to their insurance status, income level, or citizenship status, anyone can use this card because there are no eligibility requirements. We're not even collecting names. The only rule, however, is that the card cannot be combined with your health insurance. You would use the card instead of your health insurance. So if you are uninsured, of course you can use the card at any time. But if you do have public or private insurance, you would use the drug discount card instead of your own insurance. And you might want to do that if, for example, your medication is not covered, or your copayment or deductibles are too high, or if you're in a coverage gap like the Medicare Part D donut hole. Basically, you do not use this with your insurance. We have a few tools. How do you get your card? You can either print one off the website, and I'll demonstrate that to you in a moment. You can send us a self-addressed stamped envelope, and we'll send you a plastic card if you prefer one of those. If you work for an organization, business, city, town, or healthcare facility, we'd be happy to supply you with a free, limitless supply of these cards and brochures. And we'd even be happy to customize the card with your organization's name and logo on them. And if you're interested in that, you can contact me at the end of the presentation. But there are a few tools for the drug discount card, which I'll point out to you now. We've got a drug pricing calculator that will allow you to compare the discount you would receive at different pharmacies. We have a pharmacy locator on our website. If you're an organization, we can design a drug discount card app for smartphones that you can give to your constituents, and we can also design a PDF version of your organization's card for your website. And as I mentioned, there's an 800 number on the back of the card that you can call if you ever run into any trouble. So again, here is the Needymeds website. Here is the drug pricing calculator where you can click. If you click on Price Calculator, this is a third-party website, and it's being revised. So if you click here, you can select the name of the drug you'd like to purchase. You can select up to 5 pharmacies in your zip code, and you then select the quantity or the number of days you need the drug for. And then you click Price, and it will print out a table here that will allow you to compare the discount you would receive with the Needymeds drug discount card at up to 5 pharmacies in your area. If you click on the picture of the card here, you can print out a downloadable PDF of the card. And again, if you're an organization, we can make one for your own website. You can fill out the online form to request a plastic card be mailed to you. You can send us a self-addressed stamped envelope, or you can look for the pharmacies in your area that would accept your card. You can search by zip code or state. And as I said, it's accepted at 63,000 pharmacies across the country, including all the major chains. If a pharmacy is listed in this directory, they are contractually obligated to accept your card. And if the pharmacist does not know this and should happen to give you a hard time or tell them that they can't accept your card, you can always call the 800 number on the back of the card, which goes to Argus, the arbiter, and they will clarify to the pharmacist that they have to accept your card. They are legally contracted to do so. So going back to the presentation, if you are an advocate, if you work in a healthcare facility, if you're a social worker, if you're a community healthcare worker, you might want to check out the Advocates tab. We have a few resources you may be interested in. We have a patient assistance resource education course called PAIR. It's very similar to the website I'm giving you now, to the webinar I'm doing now, but it targets healthcare professionals and issues that may come up in your professional capacity. It also includes a brief exam at the end, and if you pass the exam, the student receives a certificate of completion for their portfolio. We also have a patient advocate newsletter, which comes out once a month. We also have PAPIS, which is Patient Assistance Program Update Service. You can sign up to receive daily or weekly updates every time a change is made to a PAP program. And we also have PAP Tracker, which is software that we've co-developed to streamline the application process for prescription assistance programs. So If you are a healthcare facility or an organization that helps people apply to prescription assistance programs, you may be interested in our software. Instead of filling out each application by hand, which might be time-consuming and laborious if, for example, one of your patients or clients has 5 different medicines they need help with, you put the patient's information into the software once, and it generates all 5 applications. You'll get a complete ready for signature application. You'll get monitoring of application status and the delivery of the medication. It will help you manage refills and the renewals, and it will also allow you to store documents. And if you have to file reports with your funders, it will help you generate reports based on demographics or service and management type of reports. If you're interested in that, please email me and I'd be happy to give you more information. Needymeds really looks forward to partnering with like-minded organizations, and if that's you, you might want to consider some of these opportunities. As I mentioned, we are happy to customize a drug discount card for your organization. There's no charge for customizing a card if it's printed in black and white. We'd be happy to have you as a guest on one of our webinars if you have expertise in a particular area relevant to patients' issues, saving money on medications, health topics, particular diseases or conditions. I'd also be happy to present a similar webinar to your organization as part of a staff training if you feel that Needymeds is a valuable tool for your staff. If you have expertise in a particular disease or condition, we would love to talk to you about partnering on a disease information page like the Longevity Foundation did for our lung cancer page. If you've ever thought about establishing a prescription assistance program or a co-payment card, we'd be happy to help you set up such a program. We have expertise in this area, and we'd also be happy to help you manage that program. We would love to cross-post your organization's resources on our website, in our newsletters, and our social media, and we would be delighted if you'd consider posting Needymeds on your resources as well. Also, if you are an organization that's interested in helping more of your clients or patients apply to these programs, but you just don't have the staff capacity to do that, of course you can always refer them to the Needymeds helpline, or we'd be happy to help you start a volunteer project to train volunteers in your organization to help people apply to these programs. It's called the Volunteer Project, and it includes a free manual and ongoing support and technical guidance from Needymeds as you start your own volunteer program. If you are an individual looking for a volunteer opportunity, I would introduce you to our Ambassador Program. This is a way that if you're interested in helping to spread the word about Needymeds in your community, it's a great way to get involved in your community and help people who are struggling to access health care and medications. Basically, an ambassador might give a talk at their local library introducing people to Needymeds. Perhaps they would table at a local health fair and give out Needymeds brochures and drug discount cards. Or maybe you might even be willing to represent Needymeds at a conference. If you'd like more information, I'd be happy to provide that to you as well. If you have any questions or would like a copy of this presentation, please email me at lori@needymeds.org. If you'd like to order a supply of drug discount cards or brochures, please contact deb@needymeds.org. And as always, if you or your clients or patients need help finding patient assistance programs, they can always call our toll-free helpline. We're here Monday through Friday, 9 to 5 Eastern Time, and we would be happy to help you look for programs and to answer any questions that you might have. So at this time, I'd like to open the floor to questions. So if you have any questions, please feel free to type them in. One question is, do we have any programs that might provide depends for a needy patient? I would recommend looking in the coupon section under the product name, or also looking by the diagnosis or the condition that the patient has. So you might also try the diagnosis-based assistance section for the name of the condition or the diagnosis or the disease. But maybe start with the coupon section. The question is there a search bar where I can search for a word, or must you only use the hot links within the website? Let me go back to the website. Basically, you would have to navigate the website with the links that we provide right now. At some point, we would like to have a more complex way of searching, but right now you'd have to search for, in the particular category, whether it's coupons or prescription assistance or diagnosis-based assistance. If you have a specific thing that you're looking for, feel free to call our toll-free helpline and they can help you take a look navigating the website. How can you get a PDF of this PowerPoint presentation? Simply email Lori at Needymeds. Here it is. Email Lori at needymeds.org, and I'd be happy to send you a PDF of this presentation so you can always have it. And as I mentioned, I also plan to put a recording of this webinar on our webinar library page, and it should be up within a week or so. You would find that by going to the home page, then click on Getting Started tab, and then under the Getting Started tab, you'll see a page for Webinar Library, and that's where we have all of our older webinars. Okay, and this person is asking how she can have discount cards sent to her workplace. Simply email Deb at needymeds.org, and she'd be happy to work with you to send out those cards. And let her know if you'd like those cards customized as well. She'd be happy to work with you to design a card for your constituents. Okay, just give me one moment while I read this question, please. Okay, so this person is asking how you can find out the discount you would receive with the drug discount card. I can show you again on our website. We have here's our home page, and if you go to this drug pricing calculator, this will allow you to compare the price you would receive for a particular product at various pharmacies in your area. So click on Price Calculator, and it's going to take you to a third-party website. Select the name of your drug, then you can search up to 5 pharmacies in your zip code, and then you would fill in the quantity or the day's supply, and then the last step is to click Price, and here is where it will offer you a table comparing the discount you would receive using the Needymeds drug discount card at up to 5 pharmacies in your area. And again, the discounts, this is an estimate. The discounts change every, from day to day, month to month. So this is a pretty close estimate as to what you would pay. It might be a few dollars off. And okay, again, if you're interested in customized drug discount cards, please email Deb at needymeds.org. She'd be happy to work with you to design a card. This question is, do I provide in-person trainings, or is it all webinar-based? If you are a local group in Massachusetts, it's possible I could come to speak to your group in person. We're based on the North Shore, about an hour from Boston. If that doesn't work and you're out of state, I'd be happy to provide another webinar to your organization. And also what I do is I record the webinar and then give it to your organization, so you'll always have it for future reference and you can use it when you train new staff members. So again, if you're an organization, a healthcare facility, a business, I'm happy to provide a free webinar training to your staff. It'll be at a time that's convenient for you, and it would be recorded and provided to you for future reference. This question is about oxygen equipment for the home. You might want to start by looking up diagnosis-based assistance based on the patient's condition or diagnosis to see what's available that way. You know, if it's emphysema or lung cancer, um, search for a particular condition and then see everything that's available. And also you might want to check the coupon and rebate section. Reading a question here. Um, this question is there any assistance for over-the-counter medicines and supplies? And the answer is yes. The Needymeds drug discount card can be used for over-the-counter medicines and supplies if they're written as a prescription. So you might, for example, ask your doctor to write you a prescription for glucose testing strips, or aspirin if you take aspirin every day, or bandages if you use bandages every day for a wound. Anything that you can buy at the pharmacy, ask your prescriber to write a prescription for it, and see what you can save with the drug discount card. This question is, after completing an application for a prescription assistance program, how long does it take to receive a decision? That varies from program to program. It can take anywhere from a week or maybe 1 to 3 weeks. Basically, you want to give yourself, I would say, at least 2 weeks, if not 4 weeks, from the time you apply to a prescription assistance program until the time when you'll actually receive the medication. It can take a little bit of time. And as I mentioned, if you are in a tough spot and you need immediate assistance, you might want to look in the coupon section to see if you can get a discount or a free sample of the medication while you're waiting for your application to be approved. Is there a way to tell if certain medications are covered under certain assistance programs? Yes, if you go back to the Needymeds homepage, you can type the name of your particular medication in the drug search box in the top left corner of the homepage. Or again, go to the Patient Savings tab. And when you're in the Patient Savings tab, it'll pull up all of the patient assistance programs, the different types of them. Click on Prescription Assistance and you can search by brand name drug or generic name drug. And do you currently partner with the Arthritis Foundation? No, I don't believe we do yet, but we would love to. And if you have, if you work for the Arthritis Foundation, we would love to be introduced to them because we would love to help their patients as much as we can. Would the mediator be willing to talk with medical doctors when patients have issues with medication costs? No, Argus is the arbiter or adjudicator for the drug discount card, and they only work with our particular drug discount card. They do not work with physicians or doctors' offices. If you, if you're a patient and your doctor is prescribing a medication to you that you can't afford, the first thing to do would be to tell your doctor that you can't afford it and to see if there's another medication that you can afford, whether it's a generic or another medication that might also work for you, a brand name medication. And then if that's the only medication that works for you or that they can prescribe to you, then call Needymeds at our helpline and we'll try to help you find a program that will help you get those costs covered. But no, there's no program out there or no mediator who works with physicians specifically to make sure that patients are, being prescribed drugs that they can afford, unfortunately. Someone's asking if they need to register to use Needymeds. No, you absolutely do not need to register in any way to use Needymeds. We are free. All the information online is accessible at no cost, and you do not have to register for it. So here's a question about services for rare conditions and diseases. Again, you'd want to look up the name of your specific condition or disease and see what's available in the diagnosis-based assistance section. Or if there's a particular medicine or supply that you're looking for, you could also search for those. Another question here, could a doctor write a prescription for Depends? I think so. I think that's worth having a discussion with your doctor and asking them if they can write a prescription for Depends, and then taking the prescription and the drug discount card to the pharmacist and finding out if and what the discount would be using the drug discount card. So yeah, you can ask your doctor to write a prescription for all kinds of things. As I said, aspirin, glucose testing strips, and so on, other supplies like that. So yeah, absolutely ask your doctor to write a prescription for Depends. What about coverage for over-the-counter electrolyte drinks like Gatorade for certain conditions? Again, you would look up in the coupon section, look up Gatorade and see if there's anything listed. If not, then look in the category section of the coupons, because your particular condition might have a listing of coupons associated with that condition. And again, always check the diagnosis-based assistance section for your particular condition to see what kind of help is available. That's where you'll find help for things other than medications. Like I said, it could be supplies, testing supplies, equipment, durable medical equipment. It could be house cleaning services, wigs for chemotherapy patients. So always check the diagnosis-based assistance section when you do a search. Let's see. Yes, if you want a copy of the slides I used today, please email Lori@needymeds.org, and I'd be happy to get those to you in the next few days. So I think that's all the time we have for questions. If anything else comes to mind, feel free to email me at Lori@needymeds.org. Again, if you're interested in drug discount cards, please email deb@needymeds.org. And if you or your patients or clients need help navigating the website or looking for support for a particular condition, diagnosis, or a particular medicine or supply, please call our toll-free helpline. That's why we're here. We want to help you. We're here Monday through Friday, 9 to 5 Eastern Time. Thank you so much for joining us today. I hope everyone learned something new. And please let us know how we can improve the website. We're always looking for feedback and constructive criticism. If you think of some type of information that's not on the website, but it would be useful to have on our website, let us know. We'd be happy to consider your ideas. And again, if you're interested in partnering with us as an organization, please contact Lori@needymeds.org. Thanks for your time. Have a wonderful day. And until next month, we wish you happiness and good health. Take care.